Yeah.
I'm a big believer in all medical explanations to keep it really simple. I'm just a big believer in that. I use the old fashioned light system in my office. Basically, they tell me where my staff can tell me where to go. And long story short, she's got her own button. It's a blue button in the far right hand corner. When she gets that patient into the consultation room, she hits that button. And I'm going to try and get in there in the next 2 or 3 or 4 minutes. She's already started to talk a little bit about the process, about everything else. So I kind of go in there as the doctor and try and basically back everything up. I use
Oh,
my simple story that I think I might have learned at Kent Smith's class a long time ago. Of you have a hose in your yard, it's spinning real fast. All of a sudden, it's not spinning so fast, and you have a kink in the hose, and you got a couple different options. You can cut the kink out with surgery. You can then, or you can basically go to the spigot, put more water through that kink, which is what a mask does, or you can gently unkink the hose to get the flow going again. That's what we do.
yeah.
And I usually show it with my hands. I got that one from, I think, Mark for Prosamus. Basically uses his hands and shows the jaw falling backwards and not being able to, can't breathe. You kind of open it up and you suck air. That's my consultation. Pretty simple. I mean, keep it simple. Still, I'm a big believer in that. Even when I do big full mouth rehab cases, they're not long, involved, articulated ones. I kind of show what we can do from point A to point Z.